Good afternoon, everyone, and welcome to the North Country Telehealth Partnerships bi-monthly telehealth learning collaborative. This will be our first meeting of 2023. So welcome everyone and thank you for joining. As always, we will be starting the meeting with some state telehealth updates, followed by some Medicare updates, and then we will be hearing a presentation from Aileen Martin. So to get started, I will turn it over to Kate Bliss at DOH to provide any New York State Medicaid updates that she may have.
Hi, good afternoon. There's not too much of an update from Department of Health in terms of telehealth policy for Medicaid at this point. I think I mentioned last time that we are working on post-PHE guidance that will outline exactly what's changing, what's staying the same, new billing rules. We have modifiers that we want to be used more consistently when reporting telehealth and changes to place of service. So that is going to be released in a Medicaid Update Special Edition, and we believe it will go out in February. So stay tuned for that. But other than that, we don't have any major updates to share at this moment.
Thank you, Kate. We do not have any updates on behalf of OMH or OASAS as well. Kelly, if you do think of anything, feel free to pop it in the chat. Otherwise, I'll be sure to post some links into the notes to all of our state agency websites where you could find the most up-to-date guidance and information regarding telehealth policy and regs. As for CMS, the only update to share is regarding the 2023 Consolidated Appropriations Act. Back in December, Congress did approve the year-end omnibus legislative package, and with that did impact our Medicaid telehealth flexibilities. And within that, now all of those flexibilities are going to be active through 2024. So again, and Tony has mentioned this on many of our calls previously, but those flexibilities, including waiving the geographic restrictions, originating site requirements, expanding the list of practitioners, allowing telehealth services in RHCs and FQHCs, for example. So yeah, those will all be still active through 2024. Regardless of the status of the PHE, that was extended. And from my contacts, it is looking like the public health emergency will be active until April, but we'll keep an eye on that and of course update the group if there are any other updates before we hear from that. And I think that should really cover our regulatory updates for now. And again, I'll be sure that our notes document does include everything mentioned and some links to some resources that you may be interested in. As always, if you have any questions for us, feel free to place them in the chat or email them over to us, and we'd be happy to clarify anything you may have. At this point, I do want to turn it over for our featured presentation for today's Learning Collaborative. We'll be hearing from Aileen Martin, who is the Executive Director for the Northern Regional Center for Independent Living, to talk about a project that she spearheaded, deploying some telehealth equipment to expand access. So with that, I'm just going to stop sharing my screen and switch the presenter over to Aileen.
Hi there. Can everyone hear me?
Yes.
Okay, great. Thank you. And thanks for inviting me to talk a little bit about what we have been doing over here. It'll be a very short presentation, so hopefully there's some conversation or questions or something, because like I said, there's not a ton. Northern Regional Center for Independent Living, NERCL, we are a non-residential, non-medical community resource and advocacy center. We work with any person of any age with any disability. We our goal is to advocate personal empowerment, freedom, and choice, and removing barriers which block people with disabilities from becoming actively involved in their lives. And we learned through COVID that some of the barriers could be resolved through telehealth. So what we did first was identifying the need. The need kind of showed up everywhere through the COVID public health emergency. Whether we were working from home or other remote locations, we figured out that this was an issue that affected more than just people employed at NERCL, but people using our services as well. And we identified that staff very quickly, well, most of us had equipment, but staff were issued equipment if they didn't already have it. We were all remote. I think within 10 days, everyone was working remotely, followed up by policies and procedures. So the do act, study thing. And went backwards. But we identified pretty quickly too, though, that the people that we were working with were not issued equipment. And when we as staff members were issued equipment, we got some pretty robust IT support. And even folks working, when folks using our services were not given that same level of support. And we identified that that was pretty quickly going to be a problem if we wanted to have communication. So how were we going to do this? We were pretty rapidly actually made aware that there was CARES Act and the funding from the Community Administration on Community Living. So ACL is our federal funder. We've had a long relationship with ACL before they were ACL. Our federal funds have been managed through this administration, which became ACL. So we had conversations with them, lots of conversations about the parameters around our CARES Act funding and how they could be deployed. We identified the lack of, the barriers that people were facing and what we thought could help with with enough equipment and tech support. So it's not just issuing the equipment, it's making sure people know how to use it as well. And that was going to take considerable amount of time and resources, and they agreed. So that was kind of exciting for us. Internally, we had to identify resources as well. So we worked with our IT systems administrator, who was really phenomenal and patient, and our advocates and our supervisors, to make sure that we were all prepared before we just launched, started throwing computers out into the community, that we were prepared for making sure we were documenting our work correctly, that we weren't overwhelming systems, and that our advocates were adequately supported. So at NERCL, now we have this kind of reverse organizational structure where the people at the top of the hierarchy really are our consumers, the people that we provide services to and with. And then there's advocates, and our supervisors are really support staff, and that's what we're called internally. Our job is to support the advocates and make sure that they have the resources that they need to do their jobs well for our bosses, our consumers. So this all had to happen. So we were prepared so that when we bubbled this up to the people that we provide services to, we weren't all overwhelmed and our communications were in a good place. So our IT systems administrator identified Chromebooks as the most financially efficient and effective tool for the work that we wanted to do. So they're Chromebooks that have good video cards in them, so that they had enough memory and enough technology within them that video communication would be seamless. It wouldn't be the bumpy, tricky stuff that we were doing in 2008 when I was first doing telehealth with children's mental health providers. This technology has come a lot farther, and he helped us make sure that we got the right thing. We set up the computers so that they were ready to roll before they went out, and that they would never touch NERCL's network. So there's none of the computers that we issued do we monitor through our networks. We don't know where they are when they're turned on or turned off. Our goal, and we were very upfront with Administration on Community Living about this, is that we were deploying them, and then people could use them for whatever they wanted. We didn't care, and we're not monitoring, and we don't want them back. We found that as a barrier in the beginning. Some of the folks who we were providing services to were afraid of taking them, because if they had to give them back and it was damaged, they might have to pay for them. So we were very upfront and said, we do not want them back. They're yours to use for almost anything you can get them to do. It's not a huge, robust computer system, but it's good enough to do communications with. He wrote out, our IT guy wrote out instructions for the person and the advocate, so that when they were sitting together, and they do have to sit together before they got the computers and go over how to use them, that those instructions were all there. So all our advocates were completely comfortable, which they weren't in the beginning, but were completely comfortable issuing a computer and guiding someone who uses our systems through how to set it up, how to turn it up, turn it on, when you're, how to link to a meeting, installing Zoom or the platform of their choice. NERCL uses a HIPAA compliant Zoom. So we have the business associate agreement with Zoom. Everything we do is encrypted. We also have an add-on to our Zoom for closed captioning. So they don't need all of that on theirs. All they needed was a Zoom link so that we could get back and forth and communicate with each other. For on the consumer's end, on the person who uses our services on their end, this was kind of our criteria. You have to have a goal about receiving services via telehealth. So everything we do is goal oriented. Nothing happens without first a goal. So if receiving telehealth services, and we call them telehealth services, but really they're services via telehealth platform. They're not really telehealth services, they're healthcare services. So you had to have an interest in receiving that, using telehealth to receive your healthcare or peer support services. Transportation was often the barrier. So we, considered that a criteria. Name a barrier, and transportation was our most mentioned barrier. Although during COVID, it's childcare, because my kids are out of school. I'm homeschooling. It was, everything. It was, lack of work. It was all sorts of things. So, but transportation was our number one barrier. And so we use the telehealth to say that's the barrier that we're overcoming. And providers who offer services via telehealth. So if someone had a provider, if they're, had a regular someone they were seeing who said, hey, I can provide services to you via telehealth a lot sooner than I can get you an appointment, then we would get them a computer. As long as they had some goal around overcoming the barrier or receiving services via telehealth. And it wasn't that we just dropped computers off. Staff had to be educated about setting up our independent living goals that included telehealth as short range and long range goals for people. They had to be able to practice with the person. So and often that was in the same location, whether we did a home visit or whether it was in one of our offices, we would practice with the service before they left, before we left them. They would be practicing so that we knew that they had to do that. When we did this, we also opened it up to the community and said, if other providers have folks that they're working with who have these same sorts of goals, that we would get them a computer as well. There had to be some criteria, and ACL was kind of adamant about the fact that they had to be a person with a disability, and we had to have a certain amount of documentation, including some demographics on them, and they had to have a goal around telehealth. So lots of people said, I really don't have a disability. I just, wanted to get this computer so that I could, whatever else they wanted to do, then we had to refer them somewhere else. And in Lewis County Opportunities had an opportunity to get people technology, to get them equipment. Their support might not have been quite as robust as ours, but we referred a lot of folks over there who, because they didn't have a disability, we couldn't assist. So we tried to hook people up the best way we could, but it also meant educating a lot. We educated a lot of people about what NERCL does. because usually people only come to NERCL when you need us. And this was like, oh, I guess I do need NERCL after all. So there was a lot of education about NERCL in the community and with consumers or potential consumers. And it didn't really take long, maybe a month or two. And our receptionist was like, I got this. You know, the support staff doesn't have to do this. I can do this bridging. I can do the education. And he did a lot of education. Well, they both did. In Jefferson, our Jefferson County receptionist does all the receptionist work for St. Lawrence County as well. So I refer to Jefferson and Lewis, but that's where those two people physically are. The St. Lawrence County office is served by these two folks. So they both were able to explain what we had going on, explain what needed to happen next, and bring people in or get us out to their house to do the paperwork that ACL was going to require. I see questions coming in, so I can't do the slideshow and answer questions. I'm sorry. So I'll jump to the questions as soon as the slides are not on the screen anymore. Sorry, and we're almost done with slides. It's a very short presentation. Oops. All right, well, I'm just going to talk about the process because apparently oh, there it is, process. So I almost described all of it. We completed demographic form and other information forms for NERCL, created an independent living plan to help to document to ACL, who comes in and audits and says, hey, where did this stuff go? We would meet with people to receive the computer and review teleconferencing. Again, there was one, sometimes multiple home visits, and we assured people that just because you now have a computer and we can do telehealth, that doesn't mean that we have to do services via telehealth platform. We can still do home visits. We can still do office visits. We can still meet at the library. But what we knew sort of in our gut was that moving forward, when we have these weather emergencies that happen, oh, look, there's going to be 5 feet of snow tomorrow, that we could deploy telehealth to still have our visits. We don't need to cancel visits. We can still do this. So it gives people an option and consistency of contact without missing appointments. They participate in secure Zoom sessions with NERCL advocates, and then our advocates document the work in Nexil, which is our management information system. And then, then the conclusion that telehealth we find to be a useful platform for healthcare services, including peer support. It's not a substitute for all in-person service delivery. We're not substituting, we're supplementing the work that we do in person, because we know that that's important. And we have found that not everyone is as ready as they thought they were, that lots of people thought it was a great idea, tried it a few times and went, you know what, this is not for me. And that's fine. You know, again, we wanted it not as a substitute, but for our supplementing the work that we do. I'm going to stop sharing and then I can look at questions.
Thanks so much, Eileen. And yeah, if you want me to read you the questions, or if you just want to go through them, whatever, you know, you.
I can't find them, so
okay.
Yeah, go ahead. That'd be great.
I'd be happy to facilitate. Taylor's asking how many Chromebooks have been deployed and how many total are anticipated to be deployed.
We have about 35 actually that have been deployed, not as many as we thought. And we bought 85, so we've got a bunch more to go.
And are you seeing that are you know, clients not wanting them, or is it just, you know, dependent on client basis at the time?
I think the interest peaks when people have a need, right? I had this friend of mine who used to say, you know how you never really see mattress ads until you're shopping for a mattress, and then you're like, wow, everybody sells mattresses. It's kind of that until the weather gets bad and people say, oh, I really didn't want to miss that appointment. We go, oh, you know what, you didn't have to. We could do telehealth. Then people get more interested again. That's kind of what we're seeing. Or when people are sick this winter, you know, November, December, and half of January have a lot of illness. So that also has necessitated people saying, you know what, that telehealth thing might be a thing I could use because my child's homesick and I can't come in or whatever.
Another question from Bob is, how are they connecting to the service, the clients? Home Wi-Fi with cable internet, tethering to personal cell phone, satellite, And what are the minimum connectivity specs for the Chromebooks?
That is a really good question about minimum specs. I really don't know what the bandwidth minimum is. But we have, for people who did not have connectivity, we issued hotspots. So we have about, and that wasn't very many, like we have 7 hotspots out there that are still out there that people are using. If people don't use it, we grab it back. But so we've had that. There's also people that have tethered, we've taught people how to tether to their cell phone, but there's certainly data limitations on that. So the people have also learned to use the computers in their home communities, and so library parking lots are pretty popular.
Yeah, that's a great point. I know you mentioned it in your conclusion that, some people realized they weren't ready, but what other sort of feedback did you hear from the clients that received the Chromebooks?
The people, well, so people have been using their cell phones to do a ton of work already. And so they kind of understood what a computer would do, but they didn't understand how much more convenience it lent to their life. So looking things up or just, general learning, and then connecting to other providers have been the 3, things that we've heard from folks that they use them for. And again, once we issued them, we said you can do whatever you want with them. We're not looking for them back. So go ahead. So people have been grateful for the convenience, grateful for the opportunity to have, it's just easier to use than a cell phone. But people who have been using their cell phones, and so they were like, oh, this is so much nicer. And it really is. And that sort, it's kind of like in the early days of computers, one of our strategies for teaching non-computer users, and once upon a time we had lots of people who worked at NERCL who'd never touched a computer, was to let them play solitaire. So sometimes it's just finding out how easy it is to manipulate and move around, and then you start getting into the real applications. And so that's kind of, we did not try to just say this is the only application, this is how you use it, and whatever. We just said, yeah, try looking around, let's show you other things. Or if they called us for stuff, we'd say, did you look that up? And they're like, oh yeah, we could look that up, didn't think about that. So
That's great. Bob is wondering, are the hotspot locations listed somewhere so people know where they can connect to them, or were those deployed to clients specifically?
they were deployed to people specifically.
Okay. Alicia asks, did you find that your staff needed training on the Chromebooks as much as the consumers did in terms of pushing out the program to consumers?
They not necessarily the Chromebook, but facilitating a Zoom meeting took some training, so that our staff were not like, yeah, I can do this. They were very timid about, I can join a Zoom meeting, but I don't know how to start a Zoom meeting. And we did get Zoom accounts for people so that you could, schedule your own meetings, and we showed them how. But it's kind of like public speaking, and people are really afraid of that. That's what we found, is that people were really timid about that part.
Where do people go to find out who's eligible to receive one of the Chromebooks?
Good question too. I would just call us. And the receptionist is going to say, are you a person with a disability? And if the answer is yes, he'll say, okay, I'll get you to an advocate and we'll get you going.
Do you have any flyers or like communications that other partners can potentially share?
I don't. I'll look. I don't think that I do. I'm writing it down. And I don't think that I do because, one, I didn't think that we would still be doing this now. I thought that this was a temporary, thing, and that it would be done. So we didn't spend a lot of time creating a lot of stuff around it, but I will look. I could have had advocates who developed something by now.
And then Mary is wondering if you could provide an example of a goal area that a client who got a Chromebook provided.
If you give me a minute, I can jump into our can jump in and see if I can't find one, but they're simple. It's, Jane Smith would like to continue peer support, every 2 weeks, but childcare is a barrier due to illness in the family anticipated to last more than a month. Okay. Jane agrees to use a Chromebook and begin to access NERCL services via telehealth set up by Zoom appointments with the advocate. I mean, it would be that it's pretty simple. They're pretty simple.
From deploying the Chromebooks, did you or any of the advocates realize that there were any additional barriers to telehealth other than simply having that equipment, or maybe that fluency of using it? Or is there any other things that came up frequently with some of these clients?
Well, the connectivity issue, in southern St. Lawrence County, Western Lewis County, it was pretty telling. But there's not a ton of people there, so we don't have a lot of people who are impacted by that, but there are some people that this just doesn't work, and we just have to go there. And if there's a weather issue, then we can't go there because it's just, there is no broadband, period. So that's a challenge. And then what was the question? No, just the confidence and competence pieces. That people lack the confidence, and so they were hiding from practicing. But sometimes leadership, this is a great quote from my last boss. Sometimes leadership is being out in front and saying, look, let's do this. This is a really good idea. And sometimes you have to nip at people's heels and say, no, go do that because that's a good idea. So as they practice, they build that confidence. Then it's like, oh, that's easy. Yes, but you had to try it like 4 times before you built your confidence up with that. Because sometimes Zoom doesn't work either. So we do talk about Zoom this as an information highway, the same way we talk about sort of Route 12 between Loudville and Watertown. There are times when you get behind a farm equipment and you're stuck there for a while and you just have to drive slowly. And that's just how it is. So there are times when Zoom or your internet connection or anyone's internet just isn't working right now. And so you have to go slowly and say, okay, we're going to be 50 minutes late. We're going to log off. We're going to try back again. And that's just how that goes. So if we use analogies that work, then the frustration level goes a little lower.
That's great. Thank you. Bob asks, what has required the most remote IT support with this program?
What does that mean?
Yeah, Bob, if you can elaborate, feel free to unmute as well if you want to just, talk through the question. Oh, any external support?
No, not really. I mean, like, did we have to call the tech support from Zoom to get something to work, or did we have to call Spectrum to get something to work? Is that what you mean?
Yes.
Okay. Not that I can think of. No. We haven't had any. Everything's been, so I'm hesitating to tell you his name because I don't want you recruiting him, but Ben Fowler is our IT guy, and he really has been just wonderful. He's been, most of it has been human to technology interaction, and he's really good at bringing people into a confident place with that.
That looks like the last question in the chat, but feel free, of course, all of our attendees, if you think of anything while we're still chatting, pop it in. I could also change the settings, I think, to allow you to unmute if anyone wants to chime in with any questions or have a discussion. Let me see if I can do that.
And I got to say, it's kind of funny. This is my first presentation using this platform, and I can't see anybody but me. So that's kind of fun.
That is interesting.
We have
Yeah.
video communication and we don't really use it. We're just kind of using telephone.
Not seeing anything else come in. I'm trying to think of any others as well. I mean, I think this is a really great program that you piloted that I think a lot of other organizations have deployed technology for clients, but in different ways. Um, Setting goals and really having that support to the clients, but not, but really making it a little less focused on telehealth. I think that really provides a great opportunity because we know that, of course, Alien's a member of our Digital Inclusion Coalition. Digital equity goes way beyond just accessing healthcare. It assists with social isolation for so many people, just having that opportunity to, stay remote and stay safe during the pandemic, but continue learning, continue being connected to work or school. So, this has been a great model, I think, that a lot of partners can learn from.
Our
Meg
goal is
asked,
to keep it as simple as
Mm.
possible, and knowing, so I'm part of this telehealth collaborative, but you'll notice in my introduction the fact that we are non-residential and non-medical, so we're not really a healthcare provider, but we also understand that what we now call the social determinants of health, that's kind of our bailiwick. That's kind of what we do is, education and advocacy and employment and housing and all of that other stuff, and all of that went remote. And so people with disabilities who are usually also at a financial disadvantage as well, did not have access to equipment, did not have access to IT support. And so that's what we tried to provide.
Meg asks, do the consumers require any ongoing tech support?
Not much. It's really, the Chromebooks are really simple to use. So we have not had a lot, but Ben takes their calls.
Wonderful.
Ben takes your calls after the advocate. Let me say that. The advocate gets the call first because that's who the person has the relationship with. So they would call the advocate first, and then if the advocate can't resolve it, Ben usually can resolve it. And he has like driven off to St. Lawrence County to help someone figure it out. He's done that before.
I know you said you collected some demographic data to start this process. What would you say that like age ranges, any like key demographic trends with your clients that are using the Chromebooks, or it's pretty spread widely throughout the communities?
Yeah, I would say maybe not widely. So this is coming off the top of my head from what I remember, but if you want data, I can go in and pull that out. But our age ranges are like anywhere from 21 to 65. We don't have much use of folks older than 65, and kids had computers because of COVID, and schools went remote, and they could connect anyway. So so that, I mean, I would say that's our age range. The disabilities are all across the board, from chronic rheumatoid arthritis to blindness to mental health, you name it.
That's great. And I know you connected with other local providers to identify potential, patients that could benefit from this program. Wondering if there are any other opportunities to connect with providers, not to really identify patients, but say, hey, we are, releasing these Chromebooks. I know that our client does attend your practice, or something like that. Like, I wonder if there are any ways to connect with providers to know that now there are more opportunities with their patients to utilize telehealth. I think sometimes there could be some preconceived notions, or if they haven't used telehealth with the client before, they may not be offering it to them or talking about it. So that's just something I'm thinking through right now too, if there's any opportunities like that.
I think you're right. I think that there were there are providers in the community who don't offer telehealth because they're not comfortable or familiar enough with it. So I think that is an opportunity. It's probably not, probably a NERCL thing, but because, we're consumer focused, we're not really a provider organization, and I'm not sure that they, I don't know. But we did get referrals from providers, like Watertown internists would say, I got this person that we want to provide services for. Do you think you can get them a Chromebook? Like, yeah, sure, send them over. Let's see what we can do. We did have some providers who sent folks over and said, hey, could you do this? We'll try. And honestly, like I said, I didn't think we would still have units left at this point in the game. It's been more than 18 months, I think, since we got them. So I figured they would all be gone by now. But if you all know of folks who think would benefit, give us a shout.
Yeah, that sounds great. Not seeing any other questions in the chat, but I'll definitely include Aileen's contact information with our notes. Make sure everyone has that if there are any other questions about this program. Thank you so much, Aileen, for coming and talking about this program. It's really, I think, unique compared to some other similar programs that have sent some technology to clients and whatnot. So I think this has been really great for our partners to learn about another opportunity.
Good. Great. Again, it is limited to the resources that we have because our funding from ACL is done. But they are behind the mission and they know we still have the equipment. So as much as we can get the equipment out, we want to do that. We didn't build a lot of structure around it because we didn't think it was going to be a permanent thing. So again, it's easy. So feel free to make referrals.
I love that she said it's easy. I think that a lot of folks think that telehealth can be, a bit more complicated, but bringing it down to, bare bones is just as successful, and just, ensuring folks have access,
Right.
I think is, the main thing. So that's great. And we're seeing a lot of thank yous in the chat. No, you can't see it, Aileen, but thank you again. And,
Sure.
If anyone does have any last minute questions, feel free to pop those in. I'll keep the meeting open for a few minutes. I'll just say to end the meeting, the agenda and the notes documents will have some additional articles and resources linked for your review. And there's some really great telehealth events and opportunities upcoming. There's an ATA webinar on value and sustainability of telehealth investments coming up in February. There'll be an RPM event from the California Telehealth Resource Center. ATA 2023, their annual conference is happening in March, and quite a few other things. So make sure you take a look at those, and if you're interested, sign up. I'll send some recordings out. The National Center for Telehealth Resource Centers hosted a telehealth policy webinar on the 18th, and I think I could send that recording out to you as well if you want to take a listen. But otherwise, we'll close out the meeting. I don't see anything else in the chat, but I'll ensure that everything mentioned during the call is in the notes. And our next meeting will be on March. Bear with me as I open up my calendar. March 20th from 2 to 3, and there will be a special February educational opportunity as well from the North Country Telehealth Partnership. More to come on that. I'll definitely be blasting out some emails to you all in the upcoming weeks. But otherwise, thank you again to Aileen, as well as Kate, Kelly, Kim at DOH as well, and Bob for joining us today. And for always, send any emails our way on all things telehealth. Have a wonderful afternoon.
Thanks again, everyone. Bye now.